and he knows the symbols, so I'm going to bring it at our reading distance is usually 16 inches, but I'm going to see how close I am. Are you ready to play with me? When I point to the picture, Daniel, I want you to tell me.
Denise Godin is the Eye Health Officer with the St Lucia Blind Welfare Association. This is a typical day for her when she's seated in her office here in Castries, St Lucia. Denise is a Canadian who now calls St Lucia home.
Well, I'm a neonatal nurse, which is as far from vision as one can get, but all, in some ways very, very comfortable and interested in working with young babies and children. So that's my expertise in nursing. I am a nurse, and I moved to St Lucia 22 years ago with my husband. And serendipity, a friend of mine introduced me to the St Lucia Blind Welfare Association. I belong to a charity group that did some support work here. So I helped, because I am a nurse, because they were beginning an eye screening project called Eyes for Life, I became part of that project. So I, as a volunteer, was doing school eye screening in 1989, a long time ago. And I mean, I was happy, I loved it. Then eventually I went back to school to get my degree in nursing and had no work. And at the same time, the St Lucia Blind Welfare Association, through the Ministry of Health, had recognized that they needed a position in the St Lucia Blind Welfare Association for a prevention of blindness officer who would deal with sensitization of the public to blindness and vision, to do school eye screenings, to do a very general platform. So we met. I was already a volunteer, I came back, and I was hired as the Prevention of Blindness Officer. The title changed, and I am now the Eye Health Officer. So I've been doing that for a long time with the St Lucia Blind Welfare Association.
In her role as the Eye Health Officer, Denise works very closely with health officials and those in the field of education.
I do. I deal mainly with children. It just happened that way because low vision covers the whole spectrum of congenital blindness all the way to developing blindness through chronic conditions like diabetic retinopathy, glaucoma, and untreated cataracts. And so I have the whole spectrum of clients, but adult clients tend to move directly to Eye Care St Lucia, where they have a diagnosis and treatment, and they will then come back to see me once they've had all of the refractive correction possible, medical treatment possible, surgical treatment possible. If they are living with low vision, then they will come back to me, the adults do, so I can help them with low vision aids. And then also we have a rehabilitation program called Technical Adjustment to Blindness, which will help them as well. So we work in tandem together in loops. Now the children, we have a project called Kids in Sight. It's been going on for 10 years. And it started off as a one-stop shop inviting specialists to perform cataract eye surgeries on children. And it has grown into a team of pediatric medical specialists who come to address childhood blindness, which cannot be addressed because we don't have pediatric eye doctors here to do surgeries, and we don't have low vision specialists. So they have been coming for 10 years. I'm the coordinator in St Lucia, part of the coordinating team in St Lucia, because we link with the Lions Club. It's a joint project. And so I am the entrance point. And the beauty of this project, and it is a project, is that it's become a national eye health program in St Lucia, even though it's unofficial. Pediatricians refer to us. Eye specialists refer to us, and certainly schools and community health centers refer to us because they now know that we have a solution for their children who are living with blinding eye conditions. So I have become very busy with just that one project, which tells us two things. The project is successful, but we have a lot of children who are living with eye conditions that may not be totally treatable or may not be totally curable.
Denise Godin has her plate full. Driven by her passion for children and her overall commitment, her journey from Canada to St. Lucia has been an interesting and fulfilling one that's still a work in progress.
Personally, the return I get with the kids. You saw them today. You saw these gorgeous little children. We can make a difference in their tomorrow. What a big thing that is.